Welcome back to Champion News Radio, brought to you by championnews.net. This is Carol Parisi, and we have our host, JacK Roeser. And today we are talking to two healthcare experts, Dr. Ari Friedman and C. Stephen Tucker. And Steve Tucker was talking about the falsity of Obamacare decreasing insurance costs. So, Steve, what were you saying before we went to break?
I just brought some premium renewal increases for my clients, and I was just going over a couple of them from Blue Cross Blue Shield. The historical rate increases over the last 15 years for most of my clients have been 8 to 10%. This year, after January 1st of 2011, after we added on all of the new mandates under Obamacare, as of 9/23/2010, they added on over almost 90 preventative care mandates, which means that regardless of the type of health insurance plan you have, you get free preventative care, quote unquote free, no deductible, no copay, no coinsurance, no cost sharing at all on the part of the insured, even if it's an HSA qualified plan. So things like colonoscopies, colorectal cancer screenings, and a whole laundry list of them. You can find them all at HHS, or you can find them on my site, truthaboutobamacare.com. But once those were implemented, now, January 1st, they all became official. And this means on every major medical plan in the country, you either accept that rate increase or you take the grandfathered plan option, which means that you don't have to accept those mandates and you can keep your current premiums. This is what we were told by the Obama administration. We were also told that it would lower premiums by an average of $2,000 to $2,500 a year. So these are all grandfathered clients. Every one of these rate increase renewal premiums I brought, they chose to go with the grandfathered option and not add the mandates on, right?
Okay.
They thought they were then continuing on as of yore.
Correct. In other words, they didn't think they would get the rate increases. So these are what we mean, what President Obama means by free, okay? Yes, you don't have a copay or coinsurance or deductible for all the preventative care, but here's what it's done to your rates. 44.78%.
Increase.
An
increase of almost 45%.
Almost 45%, correct.
Doc,
Here's another one.
This is because of their mandates about what is going to be presented.
That's correct. In other words, preventative care mandates were the big ones,
Yeah.
okay? Also,
So normally somebody buying insurance would buy the kind of insurance that would fit their circumstances.
that's right. That's right. As a matter of fact,
But now that's ruled out.
That's been ruled out because even if you buy a consumer-driven tax-qualified health insurance plan, we've all seen John Stossel talk about HSA qualified plans and how you save money. You have a tax-deferred account where you can put your difference between a traditional plan with all the bells and whistles and a plan that will pay for a worst-case scenario situation. So the country has been shifting toward consumer-driven tax-qualified health insurance because it's so much cheaper. John Stossel did an interview with John Mackey, who's the CEO for Whole Foods, and he changed his entire idea on purchasing health insurance for his employees and went to a consumer-driven tax-qualified plan, cut the premium in half, and his employees hated him at first because they didn't have a $10 copay for everything. They had to contribute towards some of the cost. But in return, John took the half of the premium he was paying to the insurance carrier and stuffed it into a separate HSA account, health savings account, a retirement account for each of those employees. So John Stossel had him back on 5 years later after the liberals were protesting outside of his office, and the employees were protesting as well. Had them all in the audience at John Stossel's program on Fox Business. And they said, now you didn't like him 5 years ago. What do you think of Mr. Mackey today? And they all love him because they're sitting on HSA accounts with $8,000, $10,000, $12,000 in them. And if they have expenses that occur that are cost less than their deductible, they can just withdraw it tax deferred and pay for it. But whatever they don't use rolls over. It's a brilliant way to do things. But now you don't have that option. Now you got to add all these preventative care mandates on.
Right. And a point is to be made that these preventative care sorts of mandates have a long track record of increasing premiums. Here in Illinois, we got rid of these mandates about 15 to 20 years ago, and they've been creeping back one by one since then. And the classic one that I've talked about time and time again, you wanted an example of something that is absolutely going to raise everybody's premium. My wife and I have 5 kids. We're not having any more.
Infertility.
Why are we paying for infertility
The
treatment?
kids aren't the reason. There's something else here.
Right. We're done with kids.
That's the reason.
Well, we're mandated now, despite that,
Yeah.
to be paying for in vitro fertilization coverage. Why? Because the legislature in the state believes that's something we should be required to pay for.
Why should we be required to pay for that for everybody? that doesn't make sense to me.
It's a feel-good measure on the part of the legislature. They can say your insurance company has to give it to you. Well, the insurance companies don't give anything to anybody. We pay for our coverage. The actuaries who figure out your premium are happy to figure anything out.
This has been figured out long ago in the bars of the nation, where there is no free lunch.
Absolutely.
That's right.
You're paying for it one way or another.
Right.
That's right.
If the legislature said everybody should have a peanut butter and jelly sandwich when they go to the doctor, the actuaries would sit down, figure out the cost, and your premiums would go up by at least that much.
And we have to realize how bad it's gotten. In 1979, there were 252 mandates nationwide on every carrier. In 2009, there were 1,901 mandates.
That's almost 4 times as many?
That's correct. Now, Obamacare passed. As of 9/23, we now have over 2,100 mandates.
This is almost 8 times what was rationally there before the government got its big stinking boots into our health care.
And each and every one of those mandates has to be paid for by each and every one of us who purchases insurance.
Sounds interesting.
It's not just infertility either. It's hair plugs.
Right.
Oh, that's necessary.
Yeah, it's medically necessary. Drug rehab.
Is this some joke about my baldness here?
Not at all.
Or the fact that I used to be bald, Jack? I'm joking.
I have a question, Dr. Friedman. As a doctor, do we need mandates? Does the health insurance industry, and Steve Tucker, you can answer this too, are there mandates that are needed? Is that the best for the free market? As insurance and as a doctor, are there things that need to be mandated?
No, I don't believe that you need to be mandating what kind of care is provided for by people's insurance plans. A free market system where you can do what most of us do with our auto insurance is certainly the way that I think it would work best. When I call up my auto insurer, they ask me a series of questions. Do you want the rental car coverage? Do you want the medical coverage if you're in an accident?
Is a teenager driving?
You're right, absolutely. And people should be able to make those choices for themselves. My wife and I, just from a basic logical standpoint, ought to be able to say, honestly, we totally don't need the in vitro fertilization coverage. We're completely fine.
Right.
And decrease our costs. One of the things that comes up in these mandates is, well, we're going to cover 26-year-olds on their parents' insurance for free. Again, it's not free. The more people you put on an insurance plan, the more the entire group's costs go up. Everybody gets a premium increase.
They could well be in a college where there's already medical care figured into the...
Sure, they pay a fee.
Yes, right.
And it's so much lower at 24 and 25 years old anyway.
That's the point. The real solution is not to simply say that I can put my 26-year-old on my insurance plan and let everybody else in my business help me cover the costs, which is all it is, just redistributing the cost to everybody else in the business. The real solution would be is, how about we make it possible for her to buy an inexpensive plan? A $10,000 deductible, say, no in vitro fertilization coverage.
Right.
My college, graduate school aged daughter doesn't need in vitro fertilization coverage, or at least I don't need to pay for it. How about a stripped down minimal policy, covers her if she's in a car accident or gets cancer? That policy is $40 a month, $50 a month. It doesn't exist, unfortunately, because these mandates are there for everybody.
And it's gotten worse now. We all heard about President Obama saying that now you must provide children under the age of 19 coverage on a health insurance policy without regard to pre-existing conditions. So in other words, guaranteed issue. And so I had people calling me all over the country saying, hey, I heard with Obamacare, my daughter can get on. She's in a wheelchair or she has diabetes. So yes, you can. That's the law now. The insurance company acquiesced. But guess what? They're raising the premiums by 500%.
Yeah.
So it's not free. It's going to cost something. And that's not even near what's going to happen in 2014.
Well, we're not even at that.
In communist countries or socialist countries, they have a lot of trouble running the government because they don't really know the actual worth of any good that you're going to get, whether it's down to eggs or anything else, because there is no market to determine its value. So this is what's going to happen. You're going into a socialist market where the person that's going to determine the value is some bureaucrat working off of his own damn fool ideas instead of the market experience of actually what the good is worth.
Very well said.
Well, I think we have a lot to talk about here. And I guess after the break, we should probably understand what the implications are going to be for Illinois and our Medicare and Medicaid taxpayers and the long-term problems with this and the sustainability of Obamacare and what our healthcare future is going to be after the break.